we are going to go through some seated exercise for SI joint dysfunction. So the first one that we are going to do is we're going to do a pelvic tilt. So we're going to push the pelvis in, and then we're going to rock backwards, and we're going to push in, and we're going to push backwards. So this is just a slight movement that we're going to do 10 lots. So 10 pushing in and 10 pushing back. Really push that pelvis down and then push it back and away. So that's 10 sets of those. The second exercise that we're going to do is marches. So we're going to bring the knee up, and we're going to do 8 to 10 of these. And as we progress, we can start bringing and holding a leg, holding the leg, giving it a nice squeeze just to get that stretch. But for now, we're going to hold on, and we're just going to do nice and slow 8 to 10 of those. And then the next one, it's going to require a towel or a ball. So we're going to grab a towel, and we're going to put it in between our knees, and we're going to squeeze in, and then we're going to slightly release and squeeze the knees together. And again, we're going to do 8 to 10 of those. So squeeze and squeeze. The next exercise that we're going to do, so you might want to have a resistance band. I don't actually have one to hand, but we can tie the resistance band around the knees, and we're going to push out. So we can do this with just muscles alone. Push out. So we want to keep the feet flat on the floor, and we're just going to use it for the abductors, and push out. And push out. Again, 8 to 10. As we progress, we can do 10 to 12. But just for now, keep it nice and easy, 8 to 10. And the next one that we're going to do is we're going to cross our arms over, and we're going to do some spinal rotations, just to give the pelvis a little bit of freedom from the spine, a little bit of mobility within the spine. And then we can also do some cat-cows, just a little bit of spinal mobility. We'll start with just 20 seconds of just moving it. And if you can only go really slow from one side to the next, know your limits, and then again round the back, and then extend the back. If you can only extend it slightly, that's also okay. And then the next one we're going to do is a hamstring stretch. So we're going to put one leg out, and then we're just going to stretch slightly. If we can only go to here, keep the leg nice and straight, keep your bum on the seat, and just try and stretch over that hamstring. And then we're going to go to this side and stretch just until you feel a nice little stretch, nothing too invasive, and then stretch. And we're going to do 8 to 10 on each side, and then we've got room to progress further to do more reps. And then what we're going to do is, so we're going to cross one leg over the other, and then we're just going to push the foot down. So this would be instead of this, because we're less mobile and we're not able to do the figure of 4 stretch. So this is a digression. So the foot that's on top, we're just going to open up just slightly the leg, and you'll feel the stretch in the glutes. And then we're going to swap over and just push. You can help with your hand as well. Push the hand down, and we're going to do 8 to 10 of those. And then we can progress further to maybe crossing the legs and pushing the knee. Eventually we could hopefully get to this. And then what we're going to do is an external rotation. So we're going to have the legs straight, and again we're just going to internally and externally rotate the leg in and out, just to get a little bit of mobility in that joint. And then the other side, in and out, in and out, and go for 20 seconds on each leg with that one. And then we are going to go for side to side hip rotation. So what we're going to do is we're going to bring the knees together. We might want to hold on to the chair, and we're just going to rotate the knees. And eventually, if you can come further off the chair, you want to make sure you've got support on the chair, and we're just going to go side to side just to ease off that SI joint, get it a little bit looser. And for this one, 8 to 10 reps on each side, so 8 this side and 8 that side, with room to progress.